Assalamu alaikum. Dr. Hussain Bolachi YouTube channel is with you. And 28th July is the World Hepatitis Day. And today I am sharing the awareness letter to Isra University because routinely we either organize walks, seminars, or at least we issue the awareness letter. So I think you will find it very useful because Isra University Hospital is running hepatitis vaccination, hepatitis C and B treatment and research center under MAU with Sindh government hepatitis program, which is normally called hepatitis free Sindh, for ISRA patients as well as for the people who are contacting to this are referred to this center. Monthly report is also shared to the hepatitis program director, government of Sindh, coordinated by Department of Community Medicine, where I am the chairperson or the head of the department. And this activity is a public service activity and social corporate responsibility, or CSR, as well as the outreach program. Because of these technologies and awareness, messages can reach to the wide population around Isra University and even Sindh and beyond. The awareness letter is issued every day, every year by the Department of Community Medicine. So World Hepatitis Day 2026 theme is hepatitis, let us break it down. When I say break it down, means the testing services, treatment, vaccines, as well as access to everywhere. These are the barriers we want to break down or remove from the hepatitis program. There are also high-level events titled World Hepatitis Day 2026 and the breaking down barriers to accelerate hepatitis elimination. Elimination means we want to reduce this problem, not as a public health or a big problem. Let us discuss situation in Pakistan. Pakistan is mentioned officially especially because it has one of the world's highest hepatitis C burden. Again, I am repeating, one of the highest. There are other countries, but we are also touching to the highest level, even though the disease is preventable and most cases curable. So the key challenges are, but before that, I think I want to give you some world statistics which are now just available. 287 million people were living with chronic hepatitis B or C in 2024. Only 45% of babies received the hepatitis B vaccine within 24 hours of the birth. 1.3 million people died of chronic hepatitis B and C. So this is a world situation, but let us move to the Pakistan, the one of the highest hepatitis C cases. Transmission drivers are unsafe injection, which is a big problem now, leading to the hepatitis not only, but to the AIDS also and many other diseases. Poor sterilized medical equipment, inadequate screening, blood transfusion, unsafe blood transfusion, and weak infection control practices. So these are the important aspects which we want to discuss one by one. Unsafe injection. You can see that the unsafe injection is very common problem in Pakistan as well as in other countries also. So with this, I think we have a lot of problem uh, here in Pakistan. And recently, there is a report that even the supply chain of the unsafe injections is there, and uh, it is supplied all over Pakistan. And the Hyderabad, where from I am making this, is one of the important aspect. And now the trap has uh, given an instruction that a single use where the lock is put into that syringe and you can't use it second time, but the availability of these multiple use syringes, though they are packed and they are labeled, but there is a mafia earning a lot of money. So I think that is a very important aspect. And even this is reported in the Dawn and many other national newspapers. Then poor sterilized medical equipment, particularly dental equipment and journal equipment used in surgery, maternity, deliveries, and even the circumcision, which is a normal practice by the quakes or unqualified or traditional healers, we call them Nai or Hajam. Uh, then is the blood transfusion, weak infection control practices. There is least awareness about the infection control. Though the bigger hospitals, they have their department and sometimes some workshops are held. So the 2026 campaign is pushing countries to invest in prevention, testing, and treatment and to integrate hepatitis services into primary health care. Now we call it universal coverage as per Astana Declaration, so no one is left behind. In the WHO Southeast Asian region, though Pakistan is in the EMRO region, estimated that 43 million people live with hepatitis B and 8 million with hepatitis C. South Asia, in which India is also covered, but Pakistan is under EMRO. So the figure can be not exactly this, but the highest burden shows that within the parameter of the population, this is a big problem. Are you looking for uh, information on testing treatment centers in Sindh or detail in Pakistan? National Hepatitis Program is available. Its website is available. Sindh Hepatitis Program is available. And here in this poster, you can see very beautifully the hepatitis is depicted, and you can also see that uh, the hepatitis program can be visualized if I can project it again. Uh, if this comes to yes, yes. If so the yes, once again, you can see that this poster is showing that hepatitis A, B, C, and even D is there, which is part of the hepatitis B. So this affects the liver, this affects the life, it leads to the liver cirrhosis as well as. So vaccine is available, particularly in ISRA University. So I will urge our students, faculty, and the doctors that the hepatitis is one of the important problem and preventable problem. The beauty is that we have now technology, treatment, as well as preventive measures, including hepatitis B vaccination for the children, as well as we have in EPI program, it is also included. So I think it is about time that Pakistani can come together, and this awareness, just like this video, it is continuously projected and made and available and in a very simple language, then our common people will understand better. Thank you very much, and please like, share, and have your comments. And if there is any hepatitis case, visit the nearest general practitioner, hospital, program, center, and by this method, we can also eliminate. And even the hepatitis E, which is waterborne, I think, and hepatitis A. So the water, sanitation, hand washing, as well as awareness among the schools, hospital staff, general population, NGOs, that will give a boost to control and reduce, because the target is by 2030 it should not be a public health problem, means it should not spread, it should not be a public health problem, means most of the cases should be under control, registered. So with this, I think we can learn lessons from Egypt and other many countries where hepatitis had been already controlled. Thank you very much, and to the people who have talked about the hepatitis day in Sindh, particularly in Umarpur, in Yaqut University, in Isra University, as well as on the social media. That is commendable, and I will urge that this small video from the YouTube channel, Dr. Hussain Bashkolach, will give you at least some flavor and some awareness. Thank you very much. Please like, share, as well as drop comments and push the icon below uh, icon so that we can be making more videos as per the changing circumstances of health. So health is wealth, and hepatitis is a preventable disease. Let us prevent together. Thank you very much. And